I want to paint you a picture. It is a Tuesday morning, not in a hospital ward, of course, not in a dispensary, not in a consulting room. You are in a briefing room in Nairobi, or in Kampala, or in Geneva, or in Addis Ababa, or in another city around the globe. Around the table are epidemiologists, program managers, Ministry of Health official, a data scientist, and a community health specialist. You are there as the clinical voice, the person who understands what the numbers mean at the level of the patient, the person who has sat with communities and understands what the intervention feels like from the inside. Now, the conversation is about a malaria control program, or a maternal health initiative, or a tuberculosis response strategy. And the decisions made in this room will affect hundreds of thousands of people who will never know this meeting. That is a Tuesday in global health, how it looks like a typical day in global health. And it is available to you, not eventually, not after decades of experience, available to you with the qualification you already have. If you know how to position yourself for it, that is. If you know how to position yourself strategically, that position is available to you. Now, today we talk about global health and NGO careers, what they actually look like from the inside, who is hiring, what they are looking for, and exactly how someone at your state or your stage begins to move toward this space. Welcome back to After Campus. This is episode 17, week 4. And yesterday, or in the previous episode, that was episode 16, we drew the complete career map. We looked at 8 non-clinical pathways available to health professional graduates. And for many of you watching, global health was the one that sort of created the shift in the inside of you, the one that made something move, which tells me it deserves its own full conversation. So today, that is what we have. Not a surface level overview, but a deep, honest, specific dive into what global health careers look like, what the sector values, where the entry points are, and what you need to start doing right now to position yourself for it. So let's begin. And I want to begin by telling you about a nurse. I will call her Esther. Now, this nurse called Esther qualified from a nursing program in Western Kenya. A strong clinician, deeply committed. She had grown up watching her community struggle with preventable deaths. Mothers were dying in childbirth because the nearest facility was too far. Children were dying from diseases that had vaccines, and she had gone into nursing with a specific burning intention to change that picture. But 3 years into her clinical work, she started feeling something she had not expected. Not necessarily dissatisfaction with nursing itself, but a growing frustration with the sailing that it presented. The feeling that as good as she was at caring for individual patients, the structural reasons those patients were sick in the first place were completely outside her reach. And many of us find ourselves in that particular position. She could treat the dehydrated children, but she couldn't change the water system that caused the dehydration. She could manage the complicated delivery, but she couldn't change the referral pathway that brought the mother in too late. So she wanted to work upstream. at the level of systems and populations, not instead of patients. Not instead of patients, but in addition to them. That's a very important point. Not instead of patients, but in addition to the patients she was attending to. So she didn't know the term global health at that particular point. She just knew the feeling, the pull toward something larger. And then at a nursing conference in Nairobi, she met a woman who would change the frame of her entirely. A Ugandan nurse, that was. She met a Ugandan nurse working as a program manager for an international health or maternal health organization who had started exactly where Esther was. Clinical, ward-based, frustrated by the ceiling, and who had found her way into a career that let her work on the systems level without abandoning her clinical identity. So they talked for 45 minutes. They engaged for 45 minutes. Esther asked the question she had been afraid to ask anyone else. How did you get there? That is the question she asked that particular nurse from Uganda. And the program manager gave her an answer that was both simpler and more complex than she expected. And this is what the program manager said. I started by doing, not necessarily by waiting until I was qualified enough. I volunteered with a community health NGO. I took a short course in public health. I applied for a junior role I wasn't sure I was ready for. And I showed up so consistently and so seriously that eventually the bigger opportunities found me. Now, Esther went home that night and made a list. 3 things she could do in the next 3 months to start moving. Not a 5-year plan. 3 months. 3 months. 1, 2, 3. And that list was the beginning of a career that now takes her to communities across East Africa. Now, designing programs that change outcomes at the population level, doing exactly the work she felt called to do in a form she didn't know existed until someone showed her the door. Now, today, I'm showing you that particular door. When people hear the term global health, when you hear the term global health, when people hear the term global health, they often imagine one of 2 things. Either a Western doctor flying to Africa to provide medical care, or a very senior person at the WHO in Geneva making decisions about international disease control. Now, both of those images are real things that exist, but they capture a tiny fraction of what global health actually encompasses. Now, global health is the field concerned with improving health and achieving equity in health for all people worldwide or globally. And it operates at the intersection of medicine, public health policy, development, research, and community engagement. That is global health. And it includes an enormous range of roles at every level of experience. And it's done by professionals from every health discipline. So let's look at what global health organizations actually do, just to have a picture of what they actually do. Now, they do disease surveillance and outbreak response. They also do health systems strengthening, and this is improving how health services are organized, financed, and delivered. You talk about maternal and child health program implementation. You talk about HIV, TB, and malaria program management. You talk about reproductive health and family planning. Talk about nutrition programs. Talk about community health, worker training and support, health financing and insurance scheme development. Talk about supply chain management for medicines and health commodities. Talk about health workforce development. They also play a critical role in research, and this is both clinical and implementation research, the ones that we had mentioned before. They play a role in health policy and advocacy. They also play a role in emergency health response. So who does this work, or who does this work in Africa specifically? Who does this work for in Africa specifically? Now, international organizations with significant East Africa presence, WHO Kenya Country Office, UNICEF Kenya, talk about UNFPA, East and Southern Africa Regional Office, talk about UNAIDS, US Centers for Disease Control and Prevention, that is CDC, talk about USAID Kenya, talk about the Global Fund, the GF, which funds programs implemented by local partners. We have international NGOs. We have AMREF Health Africa, which is headquartered in Nairobi, one of the largest African health NGOs, that is AMREF. We have MSF. We have Population Services International, or what we know PSI. We have JAPIGO. We have IntraHealth International. Among many other organizations, we have MSH, that is Management Sciences for Health. We have PATH. We have Living Goods. We have FHI 360. We have Palladium. We have ABT Associates, and a growing number of African-led organizations, quite a number. We have APHRC, which is African Population and Health Research Center. We have Africa CDC, which is African Union's Health Security Agency. We have East Africa Community Health Programs. We have various country-specific health foundations and social enterprises. So quite a number of organizations that you can begin looking out for opportunities in global health. That is not a small sector. It is a substantial employment market operating across East Africa. And they're actively looking for health professionals with exactly your background. And most graduates have no idea it exists at this scale. But this video is just opening your eyes. Here is where I want to give you something very specific, because knowing that the sector exists is one thing, but knowing what it values in candidates and how to demonstrate those particular values is what actually gets you in rooms full of those opportunities. First, they look for genuine commitment to equity and impact. They look for genuine commitment to equity and also impact. Not performed commitment, but genuine commitment. There's a difference between the two, between performed commitment and genuine commitment. And experienced global health professionals can feel it immediately, whether your commitment is genuine or just committed. Now, the candidate who is drawn to global health because it sounds impressive is different from the candidate who has spent time in underserved communities, who understands from direct experience what health inequity actually looks like, who is driven by something more durable than career advancement. For most African health graduates, this is not something you need to manufacture. It's not something you need to manufacture. You have lived it, you trained in it, you have seen directly the gap between what healthcare should be and what it often is. That experience is not background context. It is a core qualification. Having gone through that, it is a core qualification. Name it explicitly in your applications and your conversations. Secondly, they look for people who can work across systems and disciplines. Now, global health is inherently multidisciplinary. It is inherently multidisciplinary. The problems are too complex for any single discipline to solve. And so organizations look for people who can think across silos, who can engage credibly with a clinical question in the morning and a program management challenge in the afternoon, who can read a data set and understand what it means for community practice, who can communicate with a ministry official and a village health worker with equal frequency. Your clinical training across multiple disciplines and clinical contexts has given you a more multidisciplinary foundation than most people in global health realize. The question is whether you can demonstrate that range in how you present yourself. Thirdly, they look for people with contextual knowledge, and I'll explain that shortly. They look for people with contextual knowledge. Now, this is the unfair advantage that most African health graduates carry, and almost none of them leverage. Now, international organizations working in Kenya and East Africa need people who understand the context they are operating in, the cultural dynamics, the community health landscape, the health system structure, the political economy of health in this region, the languages that are spoken by people in this region, the lived reality of the communities the programs serve. A Kenyan nurse who has worked in a rural county hospital, for example, understands that context in a way that no amount of international training can replicate. That contextual knowledge is extraordinarily valuable, and it is yours by default. The mistake is assuming that international organizations want someone who sounds international. That's a mistake. The best ones actively want someone who is deeply local, who brings the insider perspective that makes programs actually work. Fourthly, they look for specific technical competencies. Now, beyond the general profile, most global health roles require specific technical skills. The most in demand of these skills include the following. Number one, we have monitoring. Two, we have evaluation and learning. This is what you call MEL, monitoring, evaluation, and learning. And this is the ability to design, to track, and report on program outcomes. And this is one of the highest demand skills in the sector, and it is learnable. That is a good thing. We have data analysis and management, we have project management, we have report writing and proposal development, we have community engagement and facilitation, we have training and capacity building, we have supply chain and logistics for health commodities, which is highly relevant for pharmacy graduates. You have clinical quality improvement. Now, the good news is here. Several of these skills are buildable during the pre-internship period. You can build them actually during the pre-internship period. It's a free and low-cost courses in monitoring evaluation. We have project management courses, data analysis, which are available on Coursera, edX, and the WHO Open WHO platform. So a short course completed and documented during the gap year puts you significantly ahead of other applicants at the entry level. Fifth, they look for people who have already shown up. Now, this is perhaps the most important hiring signal in global health and the one most underestimated by graduates. Almost every successful entry into a global health organization I've observed involved someone who had already, in some form, shown up in the sector. As a volunteer, it could be as a research assistant, it could be as an intern, as someone who attended forums and was known in the relevant spaces. Now, global health is a sector that rewards presence before formal qualification because the work is relational and contextual, and organizations want evidence that you can function in that kind of environment before they hire you into it. That is just how they operate. Let me be very specific with you. Here are 6 entry pathways into global health for health professional graduates at your level. It's not exhaustive, but there's top 6 common entry points into global health. Path 1 is junior professional and associate roles. Junior professional and associate roles. Now, most large global health organizations have entry-level roles. Talk about program associates, talk about field officers, talk about research assistants, data officers, community health coordinators. These roles are designed for recent graduates with limited experience. They are the on-ramp, if you want to call it that way. They pay, they build your skills, they put you inside the sector, and they open the door to every subsequent opportunity that comes along your way. Now, how do you find these entry-level roles? Now, the careers pages of every organization I named in a few minutes in this particular video. We have Relief Web, the most comprehensive aggregator of humanitarian and development sector jobs globally. We have what we call DIVEX, which is a professional network and job board specifically for global health and development. We have Idealist, which is a strong NGO sector listings. We have LinkedIn. Follow the organizations and turn on job alerts. Apply even when you feel slightly underqualified. When you see a job posting, please apply. The research is clear on this. Men apply when they meet 60% of requirements. Women apply when they meet 100% of the requirements. In global health, which actively seeks diverse applicants, apply at 70%. You don't need to feel 100% qualified. At 70%, you're good to go. Show them the rest in the interview once you're invited. Pathway number 2, fellowship programs. Now, we listed this in episode 14. We talked about fellowship programs in episode 14. You may do yourself justice by going back to listen to it after this video. But I want to go deeper on the global health specific ones. We have Africa CDC, Africa Frontline Heroes Fellowship. Specifically, this is designed to build the capacity of African health professionals in public health and health security. And applications are open annually. It's highly competitive, but it's extraordinarily valuable. We have WHO Africa Regional Office Fellowships, and this is placed within the WHO country offices across the African region. It provides direct exposure to multilateral health work. We have CDC Global Health Fellowship programs. Now, the DGHT Fellowship, it places health professionals in CDC-supported programs, and it's primarily for US-based applicants, but some international tracks also do exist. We have what we call Fogarty International Center Research Training Programs, and this is an NIH-funded research training for health professionals from low and middle-income countries. We have the Herbert H. Humphrey Fellowship Program for mid-career professionals from developing countries, and is placed at the US universities with a professional development component. We have the other one we have is Aga Khan Foundation International Scholarship. This is for postgraduate study with a strong health and development component. We have East African Community Health Fellowships. These are placements within East African Community Health Sector institutions. We have Global Health Corps, GH Corps. This is a one-year fellowship program placing young professionals in global health organizations across Africa and the US. And it's at the entry level. It's highly accessible for recent graduates. You may check their website, and it's one of the best entry points into the sector that exists. Pathway number 3 is volunteer and consultancy entry level. Now, this is Esther's part. Remember Esther, the nurse that you've looked at before, earlier on a few minutes in this particular video. This is her path, and it is more powerful than most people realize. Many global health organizations, particularly smaller NGOs and community best organizations. They welcome skilled volunteers, especially those with clinical backgrounds. Now, a 6-month volunteer engagement with a reputable organization does three things simultaneously. It does the following three things simultaneously. It builds your skills and your contextual knowledge. That is number one. It also generates civic content that signals sector commitment. And number three, it puts you inside the network where opportunities circulate informally. So before they are even posted publicly. That is what it does. How do you approach this? Identify 5 organizations doing work that genuinely interests you in that space. Then go to their websites. If they have a volunteering or pro bono section, apply. If they don't, write to them anyway. Explain who you are as you write to them, what you can offer to the organization, and why you want to contribute to their specific work. The worst outcome is no response. The best outcome is a relationship that eventually becomes a paid role. Pathway number 4 is a postgraduate study as an entry strategy. Now, a master's degree in global health, public health, or related area is the most common qualification for mid-level global health roles. And for some of you, particularly those who want to move quickly into policy or research-focused roles, it may be the most direct route for you to follow. Now, programs worth knowing about are the following, especially in Africa. We have University of the Witwatersrand School of Public Health, that is in Johannesburg. We have Makerere University School of Public Health, that is found in Kampala, Uganda. We have University of Nairobi School of Public Health, that is in Nairobi, Kenya. We have Aga Khan University Graduate School of Health Sciences, still in Nairobi, Kenya. We have African Population and Health Research Center training programs. And we have globally accessible, all these are globally, or the following are globally accessible with scholarships, including London School of Hygiene and Tropical Medicine. I know a couple of people who've gone that route. I have Johns Hopkins, Bloomberg School of Public Health. We have Harvard, T.H. Chan School of Public Health. We have Karolinska Institute in Sweden, University of Amsterdam Global Health Program, to name but a few. We have scholarship funding, and the scholarship funding includes some of the following. We have Commonwealth Scholarship and Fellowship Plan. We have Wellcome Trust African programs. We have MasterCard Foundation Scholars Program. We have Africa Oxford Initiative. And many programs have full funding available for African applicants. The barrier is usually awareness, not eligibility. That is not the barrier. The barrier is usually awareness, not eligibility. Pathway number 5 is research as an entry point. We talked about research institutions in episode 4, but I want to specifically name the global health research pathway here because research and global health are deeply interconnected. They are deeply interconnected. Now, many global health organizations run their own research programs, and many academic global health institutions are simultaneously implementing programs on the ground. Now, starting in a research role at an institution like Cambridge Wellcome Trust or APHRC or a university research department places you at the intersection of evidence generation and program implementation, which is one of the most valuable positions in the sector, and from which movement into program-facing global health roles is a natural progression. Now, we have pathway number 6. Pathway number 6. This is starting local and scaling out. Now, this is the pathway most overlooked by graduates who imagine global health as inherently international. Now, the most sustainable global health careers I have observed are built on a foundation of deep local experience. Starting in a country or in a county health department, or a faith-based hospital in an underserved area, or a community health program operating at grassroots level, building genuine, grounded understanding of how health systems actually work and fail. Now, at the level where most people actually experience them, and then using that foundation, that credibility, that contextual knowledge, that network to move into regional and international roles. Now, the person who has spent 3 years working in Turkana County, brings something to a global health organization that cannot be replicated by someone who has read about Turkana County. So start local, go deep, and let the depth take you further than the breadth ever could. Begin local, then go deep, and let the depth take you further than the breadth ever could. Now, 3 things to do this week. Not this month, but this week. You may consider it as an action point for this week. First, choose 3 organizations from the list in the video, in the earlier minutes of this video. 3 organizations whose work genuinely excites you. Then go to their websites, read their annual reports, understand their programs, follow them on LinkedIn. Set up Google alerts for their names. Whenever they post anything, Google will notify you that they have posted anything on the internet. Know their work well enough that when you meet someone who works there, you can have a real conversation about it. Not a surface conversation, but a real conversation, a real one. Secondly, identify one fellowship to apply for in the next 12 months. Identify one fellowship to apply for in the next 12 months. Go to the Global Health Corps website, go to the Africa CDC Fellowship page, go to the Fogarty Programs page, find one that fits your profile and your interest. Not the application window down. Set a calendar reminder 3 months before it opens and start preparing now. Begin preparing now. Not when the window opens, but right now, because the strongest fellowship applications are built over months, not assembled in a week before the deadline. Begin your preparations quite early. Thirdly, build one global health skill during this pre-internship period. Build one global health skill during this pre-internship period. Now, pick one from the list above. It could be monitoring, evaluation, and learning. It could be data analysis. It could be project management. It could be report writing. Learn how to write reports. Find a free course on OpenWHO or Coursera or edX. Start it this week. Complete it. Document it on your CV and your LinkedIn. Because that one completed course added to a strong profile and a genuine cover letter is the difference between an application that gets read and one that doesn't. Is the difference between the two. And I want to say something about the African health professionals' place in global health that I think needs to be said much more loudly than it currently is. I want to say it. Now, for too long, and this is a structural reality of how the sector developed. Global health was something done to Africa for too long. It was something done to Africa, and was done by organizations based elsewhere, with leadership based elsewhere, making decisions about African communities from conference rooms in Geneva and Washington, D.C. And that reality produced programs that were often technically sophisticated. But contextually, they were very shallow programs that didn't work as well as they should have, because the people designing them didn't fully understand the ground. They didn't have the contextual experience or information. That is changing. It's doing so slowly, but it is changing. The Africa CDC is an African institution. AMREF is led by Africans. That is AMREF. More and more global health organizations are actively trying to shift leadership and decision making to African professionals, not as a gesture, but because the evidence is clear. Programs designed by people with deep contextual knowledge work better. And that is it. Full stop. That is just it. Which means the moment you are entering this sector is actually one of the most significant moments in its history, when African health professionals are being actively sought, not as field staff, but as leaders in this organization, as program designers, as researchers, as the people who set the agenda for these programs. You are not entering global health as a guest. You are entering it as someone the sector genuinely needs at the highest levels. So go in knowing that, go in having that awareness, go in having that understanding. That is episode 17 of After Campus. Before you go, two things I'll ask of you, as I've always done. First is for you to move to the comment section. And in the comment section, I want to know which global health organization from today's episode is the one you are going to research this week. Name it in the comment section, because naming it publicly creates accountability, and accountability creates action. Secondly, is about the next episode. This is episode 18. So we are going into the pharmaceutical industry in episode 18. We'll be delving a little deeper into pharmaceutical industry, the full map of what pharma actually offers health professionals beyond the sales rep job, the medical affairs roles, the regulatory careers, the clinical research pathways, the medical science liaison roles, and exactly how someone at your stage begins positioning for this sector. It is a conversation that will genuinely surprise many of you, because the pharmaceutical industry is far wider and far more clinically demanding. It is far more wider and far more clinically demanding than most health professional graduates have been led to believe. And that episode drops tomorrow. I will see you then. This is Dr. Libea Bethwell, and this is After Campus series. See you in the next episode.